All right, let's rock it.
All right. Hey, Think Like a Patient group. This is D'Angelo here, and I am here with our awesome friend and guest, Alan Stern. This is not going to be a super long video or interview or anything, but someone in the group posted a really thought-provoking case about a patient that she was dealing with. And if you guys look through the group, you'll see it. It was posted by Dr. Daniels. And it was basically about a patient who presented for a second opinion because they were unhappy with their previous dentist and dental experience. And there were a couple layers to the case with this patient. One was there was an obvious layer of dental fear and dental anxiety. And two, the patient said herself that she's very holistic and she's looking for a holistic solution to her dental needs. So Alan, I'm going to kind of let you get into your thoughts on this case, and maybe we can talk about some things that everyone can learn from.
All right, first of all, thanks a lot. We did this very on the moment, on spur of the moment, so it's really cool to be here, and thanks, D'Angelo. And Doctora, your questions are absolutely awesome. They're really relevant to today's dental marketplace, for want of a better word. By the way, this is not the dental industry we're talking about the dental profession. And the way you are dealing with this, Doctora, is as a professional, and props to you for that. Excellent. Two levels of issues here. The first one's the easy one, and that's fear. Mm-hmm. And this patient is obviously afraid of something. And she put up all of these roadblocks throughout her post.
Yep.
She's nursing. She had bad experiences. I think there was something about somebody not listening to her. And I think, if I remember correctly, D'Angelo, I don't have it in front of me, there was a pain management issue as well.
Yeah. So I'll just read it out loud. So she said she has a previous bad dental experience. The needle hurt when the doctor administered anesthesia. Then they began working on my mouth and I could still feel everything. And I just want to interject right there. Like, I've had patients say they just kept working and I could still feel it. Yeah. I always wonder, like, don't you interject and say, hey, stop? I feel like some of them have like this fear of correcting the doctor or stopping the doctor and saying, hey, wait, stop, this still hurts. And they just sit there in pain. So she said she could still feel everything. Plus the next administering of anesthesia due to previous failing, I was in tears and I have not been to a dentist in over 10 years since then.
All right, so let's recognize, Doctora, props to you once again, my heartfelt respect, because it is about them, it's not about us. We have to have empathy. We have to try to put ourselves in their shoes, because if you were at the other end and someone was sticking sharp stuff in your mouth and you don't have the knowledge, the clinical knowledge that we all have, you're scared to death and you're out of control. So first things first, I think it requires a conversation just like this, whether you invite the young lady into your practice to sit down with them, if you're okay doing that in a COVID environment, or if you do it just like me and D'Angelo are doing right now, do it over Zoom, have a Zoom conference with them. Smile and reassure them, Ms. Patient, I understand, because the mouth's a very sensitive part of the body. We will work with you on that. And I promise you, Ms. Patient, I will inject slowly and I will inject effectively. And I will allow you to stop me. You have my absolute invitation to stop me. In fact, I'm not even going to go any further in anything without your permission. How would you feel about that? That verbiage is very important. Give that fearful patient a sense that you're feeling it with them, and give them a sense of control. That will break the tension right away. Remember, it's about them. It's not about you getting something done. It's not about you getting a perfect margin or a perfect occlusion, not yet. It's about their comfort in your trusted hands.
And so I like that you ended that with a question, Alan. Like you gave your spiel and then you said, and how would you feel about that? Mm-hmm. And it puts the ball back in their court. So they have the autonomy, because maybe they say, well, I feel good about that. Or maybe they say, I don't feel good about that. And then you ask your question, well, tell me more.
Yes. You know? Ooh, you're a good student. You've got much more of a memory than I do. So often, D'Angelo, and dental education is changing. My good friend Dave Karsten and a lot of other people are working very hard to change the spirit of education, because this authoritarian model, I'm the high and mighty doctor and you're the little patient, listen to me. I'm the high and mighty doctor, you're the little assistant, listen to me. That's dead. That's dead. That don't work anymore. What does work is, let's get in this together. You and that fearful patient on the same side say, all right, Miss Patient, I'm going to get you through this. I'm going to help you conquer the beast, but the beast is there and I know it. Let me help. So fear is, if you have the right approach to fear, it is so much fun. And there's nothing better than a big fat hug post-COVID, get yourself vaccinated, from a person where you've conquered the beast. I've had people break down crying on me in gratitude. I don't care how much they pay me, that's worth 10 times. Mm-hmm. So acknowledge the fear, work with it, get them past that, and then they'll do anything. Case acceptance will go up dramatically, not 100%, but it'll go up dramatically. Work with the fear.
So before we started our session, you talked about you kind of wanted to address two components of this post. Mm-hmm. One was the fear and anxiety component, and one was the holistic dentistry component.
Yes.
You have some experience in that. And
yeah,
with holistic dentistry, there's some things that, there's a great argument to think about things this way or try this way. But I feel like sometimes patients may have found resources online that are just blatantly not in accordance with anything that the scientific community supports or agrees on. Right. It's just not mm-hmm. how dentistry is typically accepted and done. So can you talk a little bit about that, like where that line may be?
So step one, you break the barrier of doctor versus patient and establish doctor hand in hand with patient. You have that established. I'm with you, Miss Patient. But doc, I think root canal is wrong. And there is a school of thought. Mm-hmm. And there is no evidence that we all can buy, but some do.
Yeah. That
root canal is no good, that fluoride is poison, and amalgam is no good. We could go down a whole laundry list of things. And the IAOMT, International Association for Oral and Medical Toxicology, is an organization that is getting louder. Some of the things they say are very good, and all of the things they say seem to be with an outward mindset toward the patient. Mm-hmm. But they have a very fixed ideology that some people are buying into. I had to dismiss a patient of 15 years who she let her teeth go to a point where she needed full upper arch reconstruction. And the wear was so bad that there was a likelihood of root canal on each and every one of those teeth.
Yeah, I've seen that they just have the bruxism down to where you can see practically see the pulp.
Yeah, and so she insisted that no root canal be done, and I insisted that I can't guarantee that, and we went back and forth. And it got to a point where my speaking with this lovely lady was diminishing in returns for me and for her. So I said, look, go to a biologic dentist. If you really, really think that anything I might do could be dangerous, then go to a biologic dentist. It's mm-hmm. okay. And she took her record. She asked for a record. She asked for the diagnostic wax up that we did. All the work I put into it, by the way, I got paid for that. But everything I did, go. So there are some people who are not going to be a perfect fit for your office.
How do you deal with like the mental barrier of like this patient's not a perfect fit for your office? Mm-hmm. Like feeling like you failed or you lost, like I lost this patient. Like
you didn't lose anything. In fact, when I dismissed this lady, let's call her Sally for argument's sake, when I dismissed Sally, I felt, number one, like I did her a favor. And number two, the God honest truth, this lady was sucking the life out of me. Sally was spending half hour after half hour after half hour, but. Oh, I'm going to do this, but. So it reached a point where we were really using appointment time for talking and arguing and depleting my energy. And she actually, get this, She had booked a 3-hour appointment for phase 1 of this thing. The Monday before the Thursday, she called me and said, I'm going to the biologic dentist. And I initially said a few things that we say in New Jersey that we won't say here over family radio.
Yeah.
And then I sat down with my team and said, we got a 3-hour block on Thursday. And they all agreed she did us a favor, because she would have eaten my heart out over stuff that I really don't see as valid, but I acknowledge that she does.
Yeah, that's important.
Look, D'Angelo, we're both married guys, right? But let's go back to our dating days. You could remember a little bit more than I did. If you meet a girl and she's just not your type and you don't want to date her again, you didn't lose anything.
Yeah.
It's fine, right? If you're a beach goer and she doesn't like the outdoors, she could. What are you losing? You need somebody who is
abundance mentality, right?
Yeah. So there are some patients. Let's get over it. Let's get out of this commoditization mode here. Let's save the profession of dentistry. I hate dental industry. You could F-bomb me all you want, D'Angelo, but don't tell me we're in an industry. We're in a profession where care, skill, judgment, leadership, and influence are what we're trained for. So if they can't follow you, how in the world are you going to lead them? How in the world? Everybody loses in that situation. If you let them fly, you've got peace of mind. They've got peace of mind. Move on to the next one. There will be other patients. I'll have plenty of other full upper arch reconstructions to do without this person sucking the life out of me and questioning everything, every stroke of the handpiece.
With these, you said like she was using up half hour after half hour consult, half hour. Mm-hmm. You probably could have saved yourself a lot more stress, and she could have been on the road with her biologic dentist sooner and happier, maybe earlier along in that process. So looking back, was there a point when you guys said, we should have parted ways sooner?
Yeah, but there was one little thing in the way, and two little things in the way. Number one, she's a member of my religious community. Mm-hmm. Number two, she's Hungarian, just like my mother. And we spent a lot of time talking about my mother.
So you had this rapport.
There was a bond. There was a connection there.
You had the 15-year relationship, the strong rapport because of these shared cultural ties.
Yes.
So it's hard.
And I said, at that last conversation, I said, Sally, you could be my friend, but I can't be your dentist. And had I been able to get past the emotion of the previous, I don't know how many conversations, and yes, I'm human too, and yes, I fall into emotional traps every now and then. Mm-hmm. But had I been able to recognize that a little bit sooner, yeah, we could have. But I didn't. I'm not perfect either. I'm over it. Thank God I didn't start that case. Thank God.
I think that's a great way to. That's a great way to close this off. I think.
Yeah.
I know you've got other stuff to get to today, but yeah. I think that this was a great little pocket conversation. Just a little 15-minute discussion to kind of verbalize some thoughts around a great Facebook post that someone made. So I'm glad we took the time to do this, Alan. Yeah,
Angelo, thank you. It was great extemporaneous reaction from both of us. Enjoy your Sunday, enjoy your personal time, and we'll see you again.
Thanks, Alan.
Thanks,
Bye-bye.
buddy. See ya.